Today we are going to talk about the kidney diseases. This is a chart which will help you to overview on the kidney diseases. So let's begin. The kidney diseases, they're usually divided into acute renal failure and intrinsic kidney disease. If you talk about the acute renal failure, it can be renal pre-renal failure, intrinsic renal failure, and post-renal failure. So depending upon the cause, the renal failure, they are categorized into these three. There are some lab findings which will help you to identify that either the cause is pre-renal, or renal, or post-renal. In case of pre-renal failure, we can see that the sodium excretion will be less than 1% because there will be less blood flow to the kidneys. Blood urea nitrogen and creatinine will be more than 20. The causes can be congestive heart failure, cirrhosis, edema, or massive bleeding, chronic bleeding. So these are the causes of the renal failure. In case of intrinsic renal failure, the kidney fails to perform its function. There will be a lot of sodium excretion. So the sodium excretion will be more than 2%. Blood urea nitrogen and creatinine will be less than 10. And in post-renal, the findings are not that much helpful. And there will be no significant change, or either maybe there will be increase in sodium excretion, or it may be decrease in sodium excretion. So the values vary. So the labs is not that much helpful in the post-renal failure. So clinically it will help you. Ultrasound and the imaging modalities will be sufficient for the post-renal failure. So if you talk about the renal intrinsic failure, it is further divided into acute tubular necrosis, interstitial nephritis, and acute glomerulonephritis. So these are the components. The tubules are the component of the nephron, what we can say the interstitium, which is present into the in between the tubules, or inside the glomerulus. This the interstitium. The problem in the interstitium that leads to acute interstitial nephritis, and that nephritis causes decline in the function of the kidneys, leading to intrinsic renal failure. Other cause is acute glomerulonephritis if the glomerulus itself is getting injured, or there is a problem, or there will be a problem into the glomerulus, and there will be inflammation and the damage of the glomerulus that can also cause intrinsic renal diseases. In case of acute tubular necrosis, you can find dirty brown cast into the urine. The sodium excretion will be more than 2%. In acute interstitial nephritis, the kidneys will be unable to concentrate the urine. There will be inability to secrete acids. There will be edema, leukocytes, and focal tubular necrosis. Some of the causes of the acute interstitial nephritis can be pyelonephritis, infection of the glomerulus or the kidneys, allergic interstitial nephritis, analgesic nephropathy, and multiple myeloma. So all these are the causes of the acute interstitial nephritis. In acute glomerulonephritis, you can find RBC cast into the urine. Let's go toward the intrinsic kidney diseases, widely divided into glomerular disease and tubulointerstitial diseases. The glomerular disease are further divided into nephrotic syndrome and nephritic syndrome. If you talk about the glomerular cause, then there will be a problem in the glomerulus, leading to failure of filtration, leads to excretion of the proteins, excretion of the RBCs into the blood. So urine analysis will show you proteinuria and hematuria. Spot test ratio will be more than 1.5, and the 24-hour urine contains more than 2 grams of the protein, while in case of acute interstitial nephritis, the benign proteinuria, spot test ratio will be less than 1.5, and 24-hour urine contains less than 1.0 gram per 24 hour of protein. So the glomerulonephritis will be further divided into nephrotic and nephritic syndrome. So how to differentiate between nephrotic and nephritic syndrome? In case of nephrotic syndrome, there will be huge proteinuria, which is approximately more than 3.5 gram of the protein per 24 hour, hypoalbuminemia, hypercholesterolemia, and edema because of loss of protein into the urine. In case of nephritic syndrome, there will be hematuria along with the proteinuria, and the proteinuria will be less than 3.5 gram per day. RBC cost would be there, salt and water retention because of failure of the kidneys to do their function, so leading to hypertension, and reduce GFR. The GFR will be less. Some of the diseases that can cause nephrotic syndrome, they are minimal change disease, membranous glomerulonephropathy, and focal segmental glomerulosclerosis. And some of the disease which leads to nephritic syndrome are acute proliferative glomerulonephritis, Goodpasture syndrome, rapidly progressive glomerulonephritis, post-streptococcal glomerulonephritis, IgA nephropathy, and Alport syndrome. So there are some diseases, one of them is membranoproliferative nephritis, glomerulonephritis type 1 and type 2, which can lead to nephrotic syndrome or nephritic syndrome. So it manifests in both of them. So let's talk about the Millet-Smith's hematuria. So hematuria mean urine, blood into the urine. It can be only RBCs. If you find only RBCs into the urine, then it can be a tumor of the kidney. So you need to go for the imaging modalities. In elderly smoker, it can be renal cell carcinoma. In babies and kids, it can be Williams tumor, and if the infection is there, it can be urolithial carcinoma. So if you find RBC plus cast crystals, then it can be kidney stone, lithiasis. So you need to go for chemical analysis. It can be oxalate stone, magnesium phosphate is there, and steroid stones, uric acid stones, cystinuria, cystine crystals, and acidic urine increases stone formation. So in the treatment, you try to alkaline the urine by giving certain medicines, so the risk of urine formation, crystal formation, will be low. If RBC and WBC both are present, it will show, or it will give you point toward the infectious cause. So you need to go for the culture. If WBC causes are there along with RBCs, it can be pyelonephritis. If WBCs are there without cast, only WBC is there, then it means that the problem is not into the kidney, it is outside the kidney, or into the cyst, into the what we can say urinary bladder, or somewhere in the urinary tract. So it can be cystitis. The E. coli is the most common organism in the GI manifestations problems, as well as the genitourinary system infections. If RBC and protein are there, it can be renal syndrome, which we discussed about, that it can be nephrotic syndrome, it can be nephritic syndrome. So you need to go for the urine, further analysis of the urine, protein per 24 hour, and finally renal biopsies. So cost into the urine, if RBC cost is there, then it indicates toward the glomerulonephritis. If WBC cost are there, it can be pyelonephritis. If it is muddy brown, that the problem is in the tubules. In case of the tubule, acute tubular necrosis. So this is the overview of the kidney diseases. Thank you.